Hey, it's Sunday, March 29th. I thought I'd just give everybody kind of a quick video update, check in, and I hope everybody is doing okay out there and quarantining and staying safe. Obviously, it's a pretty crazy world that we're living in right now with this pandemic, but I know that as long as we, respect the social distancing and quarantining and, everybody takes the appropriate precautions, we'll get through this. So obviously it's been a very kind of a little bit of a trying time for us here, especially in the Northeast in Connecticut. We're kind of in the hot spot of the country. Obviously, New York is kind of the epicenter right now in New York City, and actually southeastern Connecticut as well is in that area. We live a little bit closer to Rhode Island, and New London County itself is not still has quite a few cases, but not as many as other parts of the area. But we are doing our best to really stay at home and only go out if we absolutely have to for groceries. Cassandra will go out and wear a mask and gloves and get groceries, but that's few and far between. And then of course I have to go out probably more than anybody, unfortunately, but that's straight to the doctor's office. So I want to just kind of give an update. I'm getting ready to start round 7 of chemo. This is my last super intensive round of the really harsh drugs before I move into the kind of the trial drugs, which are more of a maintenance chemo type drugs. So it's gotten a little bit interesting with everything that's going on, especially being that my treatment's at Sloan Kettering, and Sloan Kettering's Pediatric Sarcoma Center is actually right in Manhattan. It's in downtown New York City. So that causes a lot of concern. Particular too, I get my kind of supportive care up here from a local cancer center. I will not name them in the video, but they do my blood tests, and in between rounds they do my blood transfusions, and I have an oncologist and a physician's assistant there who should do checkups in between rounds of chemo on me and stuff like that. So they actually came to me. I was getting I had to get blood checked on Friday to make sure I was good to go for chemo on Monday. Unfortunately, my hemoglobin was low, very anemic, and my platelets were really low still. So I had to get a blood transfusion on Friday for platelets, or not for platelets, sorry, for hemoglobin for whole blood. And then because of my platelets being so low, they pushed my chemo start. Sloan Kettering pushed my chemo start till Tuesday. But in the meantime, while I was at the cancer center, I was actually, because I get my treatment in New York, and my last treatment in New York had been less than 14 days ago, I was put in isolation. And the hospital administrators there at the cancer center are kind of very concerned about me being one of their patients, being that I'm treated in New York. So I was a little bit worried. There was actually some discussion about dropping me as a patient because of the risk to the hospital and other staff that because I have to travel to New York frequently. However, thankfully, we had some discussions Friday, and they're going to allow me to continue to just receive care there. However, we're trying to make some changes. So this week I've got to go down on Monday. There's some changes from Sloan as well. So we're going to go down Monday. I have to get blood tests first thing at the local cancer center here tomorrow morning to make sure that my blood counts have risen to the point that it's safe for me to get chemo. So fingers crossed that my platelets and hemoglobin have gone back up so that I can tolerate the chemo drugs. And then we have to drive down Monday and down to New York, and I've got to go to Sloan and actually get a COVID test. So I don't have any symptoms. We don't think that I have it. However, because the chemo that I do is so harsh, and it takes basically completely bottoms out my immune system, One of the precautions that they're now doing at Sloan is they're requiring all patients that are going to be going neutropenic due to chemo to get COVID tests before receiving chemo. So I'll get a COVID test on Monday, and thankfully they're actually able to do the test there locally at Sloan and provide the results in their own lab. So I'll have results within 12 hours. So by Tuesday morning, I'll know that I should be negative, that I'm negative for coronavirus. And then if that is the case, I'll be able to start chemo on Tuesday. We were hoping to go inpatient because they don't no longer allow any visitors into the hospital, so Cassandra can't come in with me. And I had requested to see if I could switch to inpatient just to reduce exposure to both Cassandra and myself having to go back and forth from the Fisher House in the Bronx to Sloan. But due to the coronavirus surge of patients, they don't have enough beds to allow anybody that's elective into an inpatient. So because my chemo is normally outpatient, it has to stay outpatient. So kind of right now the plan is we'll go down Monday, we'll get the test, and we'll go check into the Fisher House. Thankfully, the Fisher House has been really great working with us. They have an extra, basically they have an entire house that normally houses 10 families that's sitting empty right now. And so they are moving us into that house so that we'll have the entire house to ourselves with no other patients. So basically the plan is we'll check into the Fisher House. We're bringing all of our own food and meals and stuff from home down to there. So we'll check in there. And then the only thing we'll leave for is Cassandra will drive me to the hospital, drop me off for chemo, and then she'll head back to the Fisher House in the Bronx and stay there all day while I'm getting chemo, so that she's not exposed to anything outside. And then she'll come pick me up at the end of the day when I'm done. It's usually about a 12-hour or so day of chemo. So we've got that on, Tuesday, Wednesday, Thursday, Friday. And then hopefully done Friday and then back home. And then the next 2 weeks will kind of be critical for me, that I go through my neutropenic stage without getting any type of sickness and start to kind of recover. Round 8, we're supposed to go back to New York again for the first round of the trial, and that's actually for 2 weeks. However, because of the virus, we're working with my local cancer center here to see if there's a possibility, and Sloan's seems willing to kind of work with it to be able to keep me on trial, but have me receive the drugs up here close to home, so that we don't have to travel into New York and risk the exposure there and minimize us having to be away from home for chemo. So obviously it's a lot of unknowns right now. Just kind of trying to not watch too much news because can be a little bit much with all the coverage, but also trying to stay on top of what's going on, particularly with New York and Connecticut. Obviously they just had a travel advisory as well, but I think we have a plan to minimize our exposure to the maximum extent possible. I mean, I'll probably be honestly exposed the most, just having to walk from the front door of the hospital up to the pediatric sarcoma center floor to get chemo every day. But I do have a N99. I had actually ordered a special mask months ago before all this, just because being in the city and having to be around lots of people, I just wanted to be protected. So I actually have an N99 mask that's kind of specifically designed for this type of situation that provides protection for up to 360 hours. So I will be wearing that, as I transition the hospital and gloves and whatnot. And then, obviously you never know about your nurses and your doctors and whatnot, but again, I know that they're being very, very cautious there. So, anyways, so just wanted to give everybody an update. Sorry, it's kind of a long one, but I'm hanging in there. Again, round, this is kind of the last really harsh round. that I'll be doing this coming week. So I'm praying for you all out there, and please share some prayers for me as well. All right, thanks.